We are including skin cancer with chronic conditions because it is the most common form of cancer for both men and women. Let's begin with a quiz from the Skin Cancer Foundation. True or false? Skin cancer is rare. I just gave this one away. That is false. 1 in 5 Americans will get skin cancer in their lifetime. True or false? You can die from skin cancer. Yes, that is true. You can die from skin cancer if it spreads to your internal organs. Melanoma is the deadliest form of skin cancer. However, when caught early, about 99% of all melanomas are curable. That's why it's important to go to a dermatologist to catch skin cancer early, so it doesn't spread and become fatal. True or false? Skin cancer is a disease that affects only old people. That is false. Melanoma is the second most common form of cancer among 15 to 29-year-olds. True or false? People with dark skin can get skin cancer. That is true. No one is immune from the dangers of the sun. In fact, skin cancer is rarer but more deadly among darker-skinned people. True or false? Experiencing 5 or more sunburns can double your risk of developing skin cancer. That is true. Experiencing just one bad sunburn as a child or teen doubles your risk of getting melanoma. In addition, 5 sunburns by any age also doubles your chances of developing melanoma. True or false? 2 forms of ultraviolet radiation, UVA and UVB, reach the Earth and can cause skin cancer. That is true. UVA penetrates the skin even more deeply than UVB and damages the inner layer of the skin. These rays play a major role in skin aging and wrinkling, as well as skin cancer. UVB is a shorter wave that damages the skin's top epidermal layers. UVB rays are chief causes of skin reddening and sunburn and play a key role in the development of skin cancer, as well as a role in skin aging. True or false? Though a sunburn is a sign of sun damage, a tan is a sign of health. That is false. Both sunburns and suntans are signs that your skin cells have been damaged by the sun. There is no such thing as a healthy tan. Both suntans and burns can lead to skin cancer. True or false? Sunshine clears up acne. That is false. Sun exposure appears to help acne at first, but in the end it can aggravate it and make it worse. If you use acne medication, be sure to apply sunscreen, wear protective clothing, and seek the shade. Many acne medications make your skin more likely to burn in the sun, which makes you more susceptible to sun damage. True or false? SPF stands for Sun Protection Factor. That is true. SPF indicates how long it will take for UVB rays to redden the skin when using a sunscreen, compared to how long skin would take to redden without the product. For instance, someone using a sunscreen with an SPF of 15 will take 15 times longer to redden than they would without the sunscreen. An SPF sunscreen screens approximately 93% of the sun's UVB rays, while an SPF 30 protects against about 97% of the sun's UVB rays. True or false? Tanning beds are safer for you than sunlight. That is false. Remember, there is no such thing as a safe tan, especially in tanning beds. People using tanning beds may receive as much as 12 times the annual dose of harmful UVA radiation compared to the dose they receive from sun exposure. Using a tanning bed increases your risk of melanoma by 74%. What exactly is skin cancer? Skin cancer is the uncontrolled growth of abnormal skin cells. It occurs when unrepaired DNA damage to skin cells, most often caused by ultraviolet radiation from sunshine or tanning beds, triggers mutations or genetic defects that lead the skin cells to multiply rapidly and form malignant tumors. Each year, there are more new cases of skin cancer than the combined incidence of cancers of the breast, prostate, lung, and colon. As we learned previously, these cancers cause the most deaths, with lung cancer being the #1 killer. More than 3.3 million people will be diagnosed with skin cancer each year. Over the past 3 decades, more people have had skin cancer than all other cancers combined. As we learned, 1 in 5 Americans will develop skin cancer in the course of a lifetime. We have also learned from our quiz that skin cancer affects people of all skin colors and races. The good news is that if skin cancer is caught early, almost all are curable. This diagram shows the layers of the skin. The epidermis is where the squamous cells exist on the outermost layer. Basal cells in the deepest layer and melanocytes exist in the basal layer of the epidermis, or bottom of the epidermis. The melanocytes are responsible for producing pigment and for protecting the hypodermis below the epidermis. They can also be found in the eyes, hair, nasal cavity, and inner ear. People with lighter skin generally produce less melanin, resulting in less pigment. More is produced with exposure to UVB rays. Just like other cancers, skin cancer is named by the part of the body where it begins to grow. Actinic keratosis, also called solar keratosis or just AK, are scaly, crusty growths or lesions caused by damage from the sun's ultraviolet rays. AKs are precancerous growths that typically appear on sun-exposed areas such as the face, bald scalp, lips, and the back of the hands and forearms. They are often elevated, rough in texture, and resemble warts. Most become red, but some will be tan, pink, or flesh-toned. Most people see their first AKs after age 40 because they tend to develop after years of sun exposure. Detection and treatment of keratosis is important because they can progress into squamous cell carcinoma. The most frequently occurring form of skin cancer is basal cell carcinoma. More than 4 million cases of basal cell carcinoma are diagnosed in the United States each year. They are abnormal, uncontrolled growths or lesions that arise in the skin's basal cells, which again line the deepest layer of the epidermis. Basal cell carcinomas often look like open sores, red patches, pink growths, shiny bumps, or scars. They develop after years of frequent sun exposure or indoor tanning and are common on the head, neck, and arms, yet can form anywhere on the body, including the chest, abdomen, and legs. While basal cell carcinomas almost never metastasize beyond the original tumor site, early detection and treatment is important. Basal cell carcinoma can invade the surrounding tissue and grow into the nerves and bones, causing damage and disfigurement. Squamous cell carcinoma is an uncontrolled growth of abnormal cells arising in the squamous cells, which compose most of the skin's upper layers in the epidermis. Squamous cell carcinoma often looks like scaly red patches, open sores, elevated growths with a central depression, or warts. They may crust or bleed or heal and reopen. They can become disfiguring and sometimes deadly if allowed to grow. It is the second most common form of skin cancer, with more than 1 million cases diagnosed each year in the United States, and as many as 8,000 people die from the disease. Incidence of the disease has increased up to 200% in the past 3 decades. Squamous cell carcinoma is mainly caused by cumulative ultraviolet exposure over the course of a lifetime. Daily year-round exposure to the sun's UV light, intense exposure in the summer months, and the UV produced by tanning beds all add to the damage that can lead to squamous cell carcinoma. Squamous cell carcinomas may occur in all areas of the body, including the mucous membranes and genitals, but are most common in areas frequently exposed to the sun, such as the rim of the ear, lower lip, face, balding scalp, neck, hands, arms, and legs. Often the skin in these areas reveals the telltale signs of sun damage, including wrinkles, pigment changes, freckles, age spots, loss of elasticity, and broken blood vessels. Squamous cell carcinoma can grow deep in the skin and cause damage and disfigurement. Early diagnosis and treatment can prevent this and stop squamous cell carcinoma from spreading to other areas of the body. Melanoma is the most dangerous form of skin cancer. Malignant melanoma tumors originate in the pigment-producing melanocytes in the basal layer of the epidermis and often resemble moles. The majority of melanomas are black or brown, but they can also be skin-colored, pink, red, purple, blue, or white. Melanoma is caused mainly by intense, occasional UV exposure that frequently leads to sunburn, especially in those who are genetically predisposed to the disease. Melanoma kills over 10,000 people in the U.S. annually. If melanoma is recognized and treated early, it is almost always curable. But if it is not, the cancer can advance and spread to other parts of the body, where it becomes hard to treat and can be fatal. While it is not the most common of skin cancers, it causes the most deaths. Moles, brown spots, and growths on the skin are usually harmless, but not always. Anyone who has more than 100 moles or one or more unusual-looking or atypical moles is at greater risk for melanoma. That's why it's so important to know your skin very well and to recognize any changes in the moles on your body. These pictures depict benign and malignant moles and help you to identify the ABCDEs of melanoma. A is asymmetry or asymmetrical. B is uneven or irregular borders. C is 2 or more colors. D is diameter is larger than a 1/4 inch or the size of a pencil eraser. And E is the mole is evolving or changing. If you see one or more of these signs, make an appointment with a dermatologist immediately. Up next, we will look at who is at risk for skin cancer and preventive strategies.